Well, let's sit back and enjoy and find your snacks for this Web and Learn webinar. My name is Peter Bornhardt. I am a Future Ready leader in Denmark. I'm also head of a department in climate adaptation and urban development and utility and civil works. We are approximately 450 employees in Denmark, and we cover earth and environment, transport and infrastructure, and property and buildings. These three divisions. I represent earth and environment today, but I work closely with the other divisions as well, working with urban development and climate adaptation. Let's head into it. My agenda for today is these 6 topics. How has the world changed? Our framework has changed, our approach, and I'll give you some perspectives, and if the perspectives are the right ones as well. And I'll show you a project that has some measured outcome, and maybe talk about how this has changed our approach. And then I'll also give you some other examples to projects, and also talk about how their approach could have been different or could have been named different. And then I'll tell you a bit about our approach and perspective from now on, and where we are heading here in VSP Denmark, and then the all too common question session and in the end. Our framework has been joined with this this sustainable development goals that we all know so well. Our projects here in Denmark touch many goals, but today we are only gonna focus on number 3 goal, good health and well-being. But the sustainable development goals has really put a focus on the more soft side of our project. Keeping the right perspectives in projects is a key in this presentation. Research indicates that sitting on a park bench improves your sense of belonging and increases your mental health. But perhaps we could turn the park bench towards activity, and it could even increase our mental health even more. We can influence people just by smiling to them, so why not looking at people we know are smiling and having fun? In this case, kids, but it could also be people who are doing sports in the park or whatever. Studies also show that people in areas with high walkability, for instance, with several destinations and walkable infrastructure, are more physically active than people in areas with lower walkability. Maybe this doesn't come as a surprise, but the focus here, the perspective here for us should be that we always should aim to make it more attractive to walk or bike or things like that instead of taking a motorized vehicle, if possible. Because we know exercise and physical activity can help promote mental health, such as anxiety and depression. So it's important that we nudge people to become more active and physical, both take just walking a bit and doing some more exercise. Oh, it's going the wrong way. One of our projects in Denmark has this synergies. It's a rainwater detention pond. It's a little special because it could have been just a classical rainwater detention pond, but the Viborg municipality and the utility service in Viborg both wanted to do something extra, and we found the means, the funds to do something extra in this project. And It's in an area where there is an old football field. It's a little wet already. It was wet when it was still there, but today it's a huge detention pond with streams going around, and walk paths and special crossing elements has been put in, so people are more active when they go out here. And we know access to nature and communities improve public health. So this project, this is from the opening of this project, with a lot of people visiting, and you can see just up in the background there is some cars parked, and actually the municipality of Viborg actually had to extend this parking area because people were coming in from all over the place just to visit this area because it's so unique. Here are some of the pictures that try to nudge people being a bit more active, perhaps doing some exercise, different ways to cross the streams. My parents actually live up here just 1 kilometer away, and when we go there to visit them, even in the wintertime, we go to this area because it's so much fun. And also my parents, they really like to go here, even when the grandkids are not visiting. But being active, maybe even doing some exercise by pulling yourself across stream, lifts the mood of us, and we are out in the nature, out in the fresh air, and we are doing some balancing exercise, and we are doing some physical exercise, and the kids are really enjoying it. It lifts our mood. And what has this done to the area for the people in Viborg? These are some measurements that the Viborg municipality has done before and after the project has been installed. These are a number of users on a weekend in August in 13 and in 15, and it's a significant difference for this area. And even before, it was a football field in this area. So now it has been changed not to be a sporting area, but to be a recreational area, and it definitely is for people. And the mobility around it has always also changed. People decided to take the bike through this park instead of going past on the more traffic street close by. This is the change before and after on a weekday, and the before and after on a weekend. So what has this project, what could it be influencing? It could be influencing the loneliness. It could be influencing stress and depression and perhaps anxiety, because it's open area and it's very clear where you can walk and how you can walk. Other projects that we have been working on in Denmark that we are quite proud of is a demonstration project where we investigated how we could make climate adaptation in a courtyard, and how this could go hand in hand with the development of green and recreational rainwater solutions. This project was, the courtyard looked like this before, and it wasn't inviting people in, and it was quite a sad looking area. Today it looks more open, and there are different areas to be in, areas with social interaction, areas with peace and reflection, and there are also areas where the kids can play. Installment of greenhouses and orchard has been done as well. so people get a sense of community. And then there's water play areas like the pond here, and the rainwater is actually recycled through a biological filter, so it's quite safe to play in this water. What has this courtyard done? The focus has not been to look into these elements, but perhaps it has moved to the sense of loneliness. Definitely, it can help with the stress and depression and anxiety, because you can go and it's an open and inviting area, and you can find a relaxation time there. Other projects is a sustainable shared living that we have been working on to make a design catalog on how you can be more sustainable, self-providing food from greenhouses, kitchen gardens, orchards, animal husbandry, sustainable energy consumption, the sense of being a part of a greater community and togetherness. We know communities is almost the only thing that fights loneliness. So building areas where you improve this and you try to find time for people to be in a community is quite important. Another project that is quite common is reinventing areas around public places like this People's Park and all is the park around the town hall and all. It's a connecting thoroughfare for the people in order between different places of the city where you could go shop. This area was before just a huge parking lot with a small part of a garden, and now the garden has evolved and has been bigger, and there are rooms for everything there now, and it makes people stop up when they go from one place to another through this area, and it invites people in, and it's supposed to be the center for people to meet up as well, and it has brought nature back to the city, and again fighting loneliness, stress, depression and anxiety in this project, but it's not the main focus of this project, but it has an influence on it. Some weeks ago, we saw on another Snack and Learn webinar presentation of this Tåsinge Square as well. There was a climate adaptation with nature-based solutions. Has brought in a green oasis into this dense city area, creates a meeting place for the neighborhood's residents and gives the residents access to nature. And it's a beautiful example of how you can combine these two elements, climate adaptation solutions and building something for the society as well, with small designs. Also, our climate city in Middelfart is a good example of how you can make these nature-based solutions with a greater purpose. This area is a kind of playground area, an area where you do some sports. It has a multifunctional solution. It can store some rainwater. It's the rainwater, when it has a cloudburst, it moves from the left to the right, and it's get stored in these areas as well. And it makes people more healthy, because when it's not raining and the rain has moved away, you can go and play, and there are different types of areas here, and it's close into nature. There are trees and greens around it, and it's more healthy and more fun for the citizens. And these areas, they can fight loneliness, and they can fight stress and depression. Anxiety is more It depends on how many people, I would say, are here in the areas. It could be, but it could be with the right lighting and the right, if it wasn't too noisy as well. The main challenge is how do we measure and how do we evaluate improvements to the mental health? Can we even measure this? In VSP Denmark, we found out that we weren't champions in this, so we built a collaboration platform with these three other actors. Social Action Platform, which is a philosopher that works a lot with the people's need and how people interact. Aalborg University with the Department of Planning for Urban Sustainability and Center for Design, Innovation and Sustainable Transition, and then De Facto, which is health practitioners and researchers within Aarhus University, owned by the municipality, the region of Central Jutland. We needed to think broader in our cross-sectorial to collaborate to get the knowledge out. And the healthcare service, we didn't know much about this. They actually have 5 elements they work in. They work with health promotion, they work with prevention, they work with the treatment. This is where it starts to hurt somewhere, and rehabilitation and palliation. And we think that we should reverse the efforts from the rehabilitation process, which is well known and well researched, and bring it up front so it can prevent elements from happening, or it can help us understand what influences what. We all know we could twist our ankles, and we stand on this wobbly board to strengthen our ankles. But how? And then we stop it if the ankle stops hurting. But if we kept on standing on this board, maybe just for 1 minute every day, our ankle would be strong for a long period of time, and maybe not twist our ankle again. Perhaps we could bring some of this rehabilitation work up front, so we prevent stress from exploding into our face, but we also need to change our design behavior to prevent this from happening, because there are no rules now to how to make areas accessible for the mental accessible. It's only physical accessibility we are working on at the moment. This platform is working on how to promote well-being through our projects. We are on the stage of doing some literature study on health rehabilitative solutions, so we can bring it into our project and bring it into our designs and into our design catalogs. We want to work consciously to make health and well-being a parameter included in the assessment of strategies and solutions. On the short term, we're going to work with solutions into our projects. We need to collaborate cross-sectorial to implement solutions, and we need to find measures, methods to measure health. We also need to make a landscape for the stakeholders who should be involved in this, who are we influencing, who has a say in the elements that we try to influence. And on the long term, we need to establish a baseline on the health that could be done in a project where we measure another project where we don't do all these elements. Confirming the effect through study and measurements is also needed, because otherwise it won't be asked for. And we need to find these cross-sectorial gains. If one sector is involved, they need to be able to see their gain in this. And then we want to contribute to knowledge building and collection of experience and communication about the health in this project. Yeah, it's supposed to go on question, but it doesn't.
No worries. Thanks, Peter, for a fantastic presentation and really inspiring to learn about this collaborating platform at WSP in Denmark. So thanks again for joining, everyone. This is now the Q&A session. You can feel free to ask questions in the question box on the GoToWebinar platform, and also the presentation is available to download in the handout box on the GoToWebinar dashboard. I will start with the first question we have. Are you working on any project where the focus is improving well-being at the moment?
Yeah, we are working with two projects and to come in on two projects. It's a little bit different. It's not like we used to, because we want to work on a long scale on measuring for decades on the effect, because trying to influence the mental health is not an effect you can see instantly. You have to see it evolve over some time. How long time that is something we don't know, but that's why also we have brought in the health practitioners and the researchers from the health department to work with this. But we have two projects that we work on at the moment, trying to come in and find how we can work for 20, 30 years studying this.
Thank you. Regarding collecting data, what kind of data could be collected to measure the improvement of well-being?
Well, there's always the questionnaire, the surveys, but if we do not want to involve people all the time, it's possible to collect some data from the sewer systems. We have been involved in collecting or measuring the COVID level from the sewer systems. We're actually collecting levels from our own offices in Denmark to measure whether there was COVID. So you can actually measure a lot. You can measure how healthy food you eat, how much healthy food you eat in an area. So there are many ways to measure this, but the best way is possibly to measure through a survey.
Thank you. Is there any concern with the data privacy with the data collection?
Yeah, there is. You could feel surveillanced if we measure from data in the sewer system, for instance, or measure usage of something, medicine in the sewer. You could feel that you are being surveillanced. That's also why getting into a project like this to study the effect is quite difficult, because you need the approval from the people in the area. Mostly it's also comes down to how many people are you going to measure. So you can't find your way back to one person. That's the most important thing.
Thank you. I have a question here regarding green living walls. There are several questions. I will start with those. How can urban greening or living walls help with improving well-being? It has been researched that green space do help people with mental well-being. Can green walls in external and internal space encourage this? What are your thoughts?
Yeah, there's first of all, going outside, it can there are some research that shows that it can take some pollution from the streets out of the air. It can also function as an acoustic wall, so the sound from the streets and even from an office can lower. And then just the effect of looking at green is also something that researchers say that has a great influence on your mental well-being and your level of stress. So this could be really a good element to implement into your streets, and perhaps it's the last couple of square meters that we have to bring back nature into our cities. Is the walls, perhaps.
Thank you. There's a question here. Have you considered using WHO-5 as a measurement on mental health and well-being?
Yeah, actually we have, but that will be in a survey as well, and we want to look into how can we measure without disturbing people. So, and because if we disturb people too much, they might feel surveillanced. If we keep sending them questionnaires, they won't be attending the questionnaires as much. So we need to make something has to be measured by automation or with a digital solution like in the sewer systems, and something has to be done by a questionnaire. But that one we have been thinking about.
Thank you. I will take the last question. What kind of obstacles do you face with clients in projects related to well-being?
Yeah, just these projects that the one project that we are looking into, it's a developer, and some developers they need to see the economy for from their perspectives, or we need to be able to see the economy from their perspectives. So what is their gain? And it's mostly it's economy that's they have their focus on, but there's also something about looking into the urban space and trying to put a value on this area that is being worked on in Denmark at the moment as well. But the gain, the economy gain is really strong, and we need to be able to sell these elements into projects. That's our main focus.
Thank you. Thank you, Peter, for a fantastic presentation, and thank you everyone for joining us today. You will receive Peter's email in the recording that I will share with you as well soon. So thanks again for joining our Snack and Learn webinar, and thank you, Peter, for your presentation.
Yeah, you're welcome. Have a nice evening or day.
Thank you. Bye-bye.